Hello, my name is Scarlett Lawson. I'll be performing a neuroassessment video, and I'm a student at the University, Mayville University. So we're going to be performing the cranial nerve assessment 1 through 12 first. So cranial nerve 1 will be the olfactory nerve, and we'll be checking for smell. Jax, close your eyes for me. Let me know what kind of smell you smell. He said root beer. That is correct. Next smell you have? Alcohol. Perfect. So his olfactory nerve, cranial 1, is intact. We're going to move on to cranial nerve 2, which is our optic nerve. So I'm going to have you turn right over here, Travis, and read the Snellen chart that we have. I'm going to have you read the smallest that you can see. Perfect. That's perfect. 20/20 vision is distant vision. You can turn back around for me, and we're going to look at the Rosenbaum chart. I'm going to have you read the smallest that you can see off of this chart.
428.739.
Yes, that's perfect. Great. So Rosenbaum, the near vision, was assessed, and that was appropriate for Travis. 20/20 vision as well, the near vision. So we're going to move on utilizing the ophthalmoscope. I'm going to look for the optic nerve as well as the red reflex in both eyes. I'm going to have you look here towards my ear. Do you see the optic nerve? And the red reflex is present. Keep looking that way. You see the optic nerve and red reflex. So bilaterally, those are both present. So we're going to move on to cranial nerve 3, which is oculomotor. You'll utilize the 6 cardinal movements of gaze. So I'm going to have Travis, you look straight here forward. I'm going to have you follow my finger. Great. So Travis did pass the test, no problem. I'm going to also utilize my senses that I did notice when I was looking at Travis's eyes. His pupils were round. They were round bilaterally. They were equal. They were reactive. Pupils are about 5 millimeters in size. I'm going to check to see if Travis's pupils are reactive to light. Have you look at me, Travis. Okay. Okay, pupils are equal and reactive to light and accommodation. We tested that after that 6 cardinal movements of gaze. So we're going to move on. I noticed that Travis is not having any drooping. Eyes again were equal, which would be when he opens the eyelids, he does open those normally without difficulty. That's cranial nerve 6, which is the abducens nerve. We're going to look at cranial nerve 5. That is trigeminal. I'm going to have Travis clench your teeth for me. Great. You can rest. Clench your teeth again. Rest. Teeth one more time. Rest. Perfect. That's our cranial nerve 5. He did pass that, no problem. Again, that was a normal accepted finding. His sensory, I'm going to actually have him test for dull, sharp, and light touch. Have you close your eyes, Travis? And I'm going to test these. So let me know if you feel like dull, soft, or light touch.
Sharp. Sharp. Light. Light. Dull. 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 Sharp. Sharp.
Great. So again, cranial nerve 5, trigeminal nerve, is intact. Cranial nerve 7 is a facial nerve. I'm going to have you wrinkle your forehead. Okay. I'm going to have you smile. Puff out your cheeks. I'm going to have you purse your lips and puff out your cheeks. Great. I'm going to have you show your teeth. And I'm going to have you squeeze your eyes shut. Perfect. Okay. Cranial nerve 7 with the facial nerves were intact. We're going to look at cranial nerve 8, the acoustic nerves. So we're going to use the Weber test. Let me know if you feel this vibration bilaterally. Great. I'm going to do the Rene test. A test for bone conduction and air conduction. Do you feel that? Okay. When you stop feeling that, I'm going to let you know, and you're going to listen to see if you can hear that by your ear. Can you hear it? Let me know when you can stop hearing it. Okay. Why don't you check the right? You feel that? Okay. Let me know when you stop feeling it. Okay. Let me know when you stop hearing it. Can you hear it? Air conduction was her longer than bone conduction, which was a normal accepted finding in the Renee test. Moving on to the cranial nerve 9, which is a glossopharyngeal nerve. I'm going to have you open your mouth. Right. When you open your mouth, perfect. Uvula is midline, is intact. I'm going to have you swallow for me. Great. So palate does rise and Travis swallows, which is a normal expected finding. We're assessing the glossopharyngeal and the vagus at the same time. So I'm going to take Travis's gag reflex. Open your mouth for me again. Okay, great. Travis does have the gag reflex that is intact, which is cranial nerve 10, the vagus nerve. The glossopharyngeal muscles are intact when I was looking at Travis's mouth, so that's a perfect normal finding. So we're also going to move on to cranial nerve 11, which is the spinal accessory nerve. So I'm going to have you shrug your shoulders for me. Okay, back down. Shrug with resistance, perfect. I'm going to have you move your head from side to side. Great. I'm going to have you move your head with resistance to the left, okay? I'm going to you're looking at this sternocleidomastoid muscle. It is there, it is midline. To the right. Sternocleidomastoid muscle is midline, is intact, is where it needs to be. So those were normal expected findings. Moving on to cranial nerve 12, that is the hypoglossal nerve. I'm going to have you stick out your tongue, move it from side to side, tongue up to your nose, down to your chin, and up on your palate, down. I'm going to have it to your cheek, to your other cheek. Perfect. Hypoglossal nerve was intact. The coordination of fine motor skills. So these are going to be a couple different assessments we're going to do here. The Romer test is going to assess for his balance. So stand up for me, Travis. Close your eyes. Notice. Okay, open your eyes back up. Sit back down. So there was no issues with Travis swaying or moving from side to side. So that assessment finding was normal. So fine motor skills. We're going to look at Travis. I'm going to have you take your hands one at a time. We're going to have you pat your knee and flip it over back and forth and move quicker from one hand. Perfect. Do your left hand the same way. Perfect, great. So I'm gonna have you scoot back for me. I'm gonna have you touch your nose and touch my finger when I say so. Okay, nose, finger, nose, finger, nose, finger. Okay, left hand, nose, finger, nose, finger, nose, finger. Perfect. Great. No issues with his motor skills. I didn't see any problem, I would think. So we're going to move on. Didn't see any ticks, no tremors. I'm going to move on to the gait. I'm going to have you walk from here to here and walk right back to your sitting position. Okay. Notice Travis does not have any gait issues, which is again a normal expected finding. So I'm going to look at the superficial touch and the primary sensory function. So I'm going to utilize a cotton wisp. Let me know when you feel something. Close your eyes. Perfect. So again, this primary sensory function was intact. So I'm going to have you check for sharp or dull utilizing the tongue blade we have here. So close your eyes, Travis, and I'll let you know when you feel something. This assesses for pain.
Yeah.
Perfect. Okay, perfect. So Travis does have this pain perception is intact. So vibratory response is going to use the tuning fork as well. And then he's going to let me know when he can feel this on his sternum, his elbow, wrist, shin, and ankle.
Yeah. Yeah.
Okay.
Yeah. 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 Yeah.
Okay, hold your legs up.
Yeah. Yeah. Yeah.
Okay, perfect. So we're going to move on to the perception of position. So I'm going to have you close your eyes. I'm going to put a couple objects in your hands. You're going to let me know when You feel that, you let me know what you think that they are, okay? You can close your hand and feel.
Key.
Okay,
Coin.
perfect.
Key.
Okay, last one.
Coin.
Perfect. So there was no issue with the, that I would think there's an issue with identifying by touch. That was the assessment I performed. The perception of position, which I accidentally said earlier. Perception of position would be the letting me know if you feel me move your finger up or down, okay?
Okay.
So let me know.
Up. Down.
Okay. Other hand.
Down. Up.
Perfect. So there was no issues with perception of position. So 2-point discrimination. I'm gonna let Travis, you're gonna let me know when you can feel me touch something with 2 or 1, okay?
Okay. 1. 2. 2. 1.
Perfect. 2-point discrimination was intact. Moving on to identifying letters and numbers. I'm gonna have you hold your hand back out with your eyes closed. Let me know if you feel a letter or number and let me know what that would be.
8. C. 8. C.
Perfect. No problem with identifying letters and numbers on both hands bilaterally. So I'm gonna let you know, let me know when you feel me touch you, just in general. Keep your eyes closed.
Yeah. 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 Yep. Yep. Yep.
Perfect. So we're moving on to the superficial reflexes. So those are going to be your abdominal reflexes, your plantar reflexes, and your cremastic reflexes. Lay down, Travis. I'm going to have you pull your shirt up for me. And you don't do anything. Okay. I noticed in all 4 quadrants of his abdomen, I did notice that Travis did have his reflexes present. Sit up for me, Travis. I'm going to use the plantar reflex. So what we're going to do is I'm going to have, thank you, scoot back a little bit. I'm going to look at your bottom of your foot. Yes. Reflex was present. Right. Reflexes were present, both plantar reflexes were present bilaterally. Okay, I want to look next at your cremastic. So what we would do for school purposes, we're not going to show Travis's private area, but for clinic purposes, we would, and the way we would do the cremastic reflex is we would take the area, we're going to stroke the inner thigh. We would look for Travis's scrotum and testicle to be rising on that specific side. We would do both of those. So again, in the clinical setting, we would do this. But for school purposes, we will not show that area. So moving on to the deep tendon reflexes. So those are going to be assessed. We're going to assess the biceps subrachioradialis. We're going to assess the triceps, the patellar, as well as the Achilles tendon. So biceps, I'm going to have you hold your arm out for me. Okay, just relax. I'm going to look at the brachioradialis. Okay, perfect. We'll look at the triceps. Just relax your arm, do not flex. Right, reflexes were present on all of those so far. Look at the patellar. Patellar bilaterally were intact, and now you can scoot back a little bit so we can do the Achilles tendon. Okay. Perfect. Those were both intact as well. So all of his deep tendon reflexes were intact. We'll look at the ankle clonus. The ankle clonus, I'm going to have Travis, I'm going to flex his ankle. I'm going to have you bend your foot up and back. Don't see a clonus, which is an expected finding. Perfect. No clonus noted. Thank you for watching my neuro assessment. That's the end.